British Columbia's healthcare system is overwhelmed, but is there a hidden healthcare crisis that's contributing to it? A new documentary set to release this week and aims to educate the public on how that's exactly what is happening.
People think that all the healthcare workers are back in the healthcare sector and we're kind of back to the same issue we were pre-COVID. They have no clue whatsoever that there are thousands and thousands of healthcare workers that are still being refused back into the healthcare sector.
Drea Humphrey here with Rebel News. And did you know the World Health Organization has declared the pandemic is over? Well, their fearless non-medical doctor leader didn't exactly say it in that way. He said it's no longer an emergency.
For the past year, the Emergency Committee and WHO have been analyzing the data carefully and considering when the time would be right to lower the level of alarm. Yesterday, the Emergency Committee met for the 15th time and recommended to me that I declare an end to the public health emergency of international concern.
But you wouldn't know that in the province of British Columbia, where we have draconian measure lovers like Public Health Officer Dr. Bonnie Henry or Health Minister Adrian Dix. No, we are still very much in love with some illogical mandates like that punishes unvaccinated healthcare workers from saving lives. Two Vancouver-based freedom fighters named Daniel Pistilli as well as Alicia Johnson decided to do something about this. They've teamed up with a group of healthcare professionals that are known as the Canadian Society for Science and Ethics in Medicine, and came up with this documentary that screens this weekend to show the public exactly who the unvaccinated healthcare workers are and why they need to get back to work. This is also part of a lawsuit that organization, that nonprofit, is bringing on. And so it is a crowdfunder of sorts for them. So I'm going to get right to an interview with one of their producers, Alicia Johnson, as well as one of the healthcare workers who are featured in that film, who has something very interesting that you're not going to want to miss. But before we jump to that, you should know that you would never find a report like this by the state-backed media. We are truly independent from government interests here at Rebel News, but we're also dependent on our viewers. So if you want to contribute and keep reports like this going strong, you can do so in a really fun way. You can do your Mother's Day shopping at our store called rebelnewsstore.com. And if you use coupon code MOM2023, you buy 2 shirts, you get the third one free. So very fun way to support our journalism. Let's see a clip of this documentary and then get right into the interview.
Police and security ushered nurses out, and there was no replacement for them. So there were units left without nurses. We're watching the news about the lack of care, about people dying waiting for an ambulance, people dying because they can't get life-saving surgeries, people in emergency dying in a waiting room because they don't have nurses. Here we are sitting and we're not allowed to go and help these people.
It's so cruel how these people who need just someone to be there and show them that they're worthy.
I was a registered nurse for 31 years.
I've been a registered nurse for 32 years.
I'm a family physician and I've been practicing for about 26 years.
I was a vascular surgeon at the Vancouver General Hospital for 32 years. My specialty deals only with blood vessels. In addition to that, I've been on faculty for the University of British Columbia Department of Surgery. I'm a full professor. I'm a scientist who does research. You know, these unvaccinated healthcare workers were working all during COVID. You know, they're all highly experienced. You would discard them. You would claim that it's only 2,500 official healthcare workers who are unvaccinated and are not working. But in fact, that is not true. Like myself, who took early retirement, the early retirees do not appear on any statistic. And it's estimated that the total number of healthcare workers is probably about 2 to 3 times the 2,500. So you're talking maybe about 6,000 healthcare workers. You could probably staff a fairly large regional community hospital, I would say Kamloops or Kelowna, just like that.
All right. So why don't I start with one of the producers of the film, Alicia Johnson. Thanks for joining us today. Why don't you tell us just briefly what the vision was of doing this short film and why you think it's needed?
The vision behind the film was to support the Canadian Society for Science and Ethics in Medicine and the public awareness that's needed for the judicial review that they have currently filed in the BC Supreme Court. We saw that a lot of British Columbians did not even know that this existed, that this was happening. And so we wanted to figure out a way to assist them and to be of service of them. And the best way we thought that would be was to create a documentary where they would be welcomed in people's homes on their screens and see exactly what it is that they're fighting for, which is the protection and safety of all British Columbians.
Absolutely. And I like what you said about inviting the healthcare workers into the home, because it seems like they've just been labeled the unvaxxed instead of who are you? You went from hero to zero. Christine, unfortunately, you're one of those people. Tell us a little bit about what you did and for how long.
I was an X-ray technologist for 28 years. I specialized in mammography. I also worked intensively in the emergency department at Chilliwack Hospital. I've worked in Mission and Abbotsford Hospital as well, and basically dedicated my life to my career. I loved my career. Mm-hmm.
Yeah, and one of the reasons why I reached out to do an interview with you, I mean, the film has a couple of familiar faces on Rebel News. You have Dr. York Shang, we can show on the screen right now, and you also have Dr. Sophia Bayfield. They've been great at speaking out on behalf of informed consent and bodily autonomy. But one of the stories that I personally haven't covered in this area was sort of the changes that may have happened in your field with mammographies. And you kind of touch on that. Could you let everybody know a little bit more about what it was like working during COVID and post vaccinations?
Mm-hmm. So initially, when people were getting vaccinated, obviously we didn't know if there was any side effects. And healthcare was promoting that this was safe and effective. And then all of a sudden, we got a memo to our department that we would be noticing changes in women's lymph nodes. And to me, that was an incredible red flag. Why should women's lymph nodes be changing? And so, sure enough, that was something that I did start to see in the ladies that I was doing the mammograms on. And so from that point, we had to ask every patient when they had their most recent vaccination, because it did affect many women's lymph nodes.
Wow. Now, most would think you're asking that question just to know who's vaccinated, but you're saying you received a letter that said, guess what? This is going to go up. Did the letter say specifically because of vaccinations, or you just thought the timing was suspect?
It's stated that since vaccinations, they've noticed a change in lymph nodes.
Wow. And back to you, Alicia. Now you're raising awareness about the law case. Also, I'll link that in the description. But I found in a recent report where I just, went on the street, I went with a nurse, Aurora, and we walked around and just talked to people to see what they still thought about lingering vaccine mandates in British Columbia. Most people didn't even know it was a thing. I guess this question could go to both of you, starting with Alicia. Is that what you're finding in your activism on this issue, that people are not even aware that our healthcare workers aren't all welcome back?
Oh, absolutely. Most are walking around thinking that, everything is back to normal, that, all our healthcare workers are back in the healthcare sector and, they're just short staffed because we already had a system that was, not functional and was still, I want to say crippled in a way because of short staffing issues prior to COVID. And so, now it's people think that all the healthcare workers are back in the healthcare sector and we're kind of back to the same issue we were pre-COVID. They have no clue whatsoever that there are thousands and thousands of healthcare workers that are still being refused back into the healthcare sector.
Mm-hmm. And I think Nova Scotia is the only other province that has a blanket mandate. There are some hospital authorities in like Ontario that are preventing unvaxxed healthcare workers from working. Christine, what about yourself? What about the people that you know that you used to work with? And what do you know of the state of the hospital that you used to work with since being laid off? Were there others laid off with you?
Yeah, so there was a group of us that were let go from the X-ray department. A couple of other mammography techs, an ultrasound technologist, and at that time, our mammography department had to close down. It was closed down for quite some time. I know that it's up and running again, but yeah, they're still quite short-staffed. They're struggling. All over the hospital, there's still a need for healthcare workers.
And what do you make of, we now know the World Health Organization has officially said the COVID-19 pandemic is over. Yet in British Columbia, you have our public health officer recently signing off just last month on an extended mandate against healthcare workers, also including post-secondary workers for the vaccine. What does that feel like for you?
It makes me sick. I have been my mind is blown that there is so many trained professionals and that somebody can go into the hospital to volunteer that's unvaccinated now, but the trained professionals cannot.
Wow.
And to me, that says it all. It's a slap in the face. I had complete COVID training from the onset of COVID, how to handle any kind of airborne symptom. And I know I'm trained to use a mask. I'm trained to use gloves. I'm PPE, like every part of that for 28 years. Yet anybody can go in the hospital now except for me. Makes no sense.
It makes no sense. Now, Alicia, I'll finish with you. Where can people go to watch this film? And after its screening, what are the plans for it?
So the live screening is going to be at Lionsgate Christian Academy, which is in North Vancouver, 919 Tollcross Road. And that is this Saturday, May 13th. The doors will be open at 6:00. I want to stress to everybody, this is a free event. We do not want anyone to not be able to come and join us. All we're asking is when you come, if you can donate to support the society, because 100% of the proceeds are going to them, and it's whatever you feel called. There's no specific denomination or amount. And after the event on Saturday, we will be having it uploaded live on frw.world, which is our digital creator site. It'll always be there to make sure that it cannot get censored. It will circulate through social media as well. And you will also find it on the Canadian Society for Science and Ethics in Medicine's website, because we want to drive awareness to them, because they are the ones that are doing the judicial review. Once that is complete, then the next steps is figuring out a way to make sure that all of our MLAs, our mayors, our city councilors are given access to this, because they need to see exactly what's going on, and that understanding that the public is about to become hyper aware of what's being intentionally done, which is catastrophic to our citizens of this province.
Wow. So again, I will link the information to basically what Alicia just said in the description box below. Thank you, Christine and Alicia, for joining us on Rebel News.
Thanks for having us.
At Rebel News, we fearlessly bring you the other side of the story, and we are completely separate from government interests. If you'd like to support our journalism, do your Mother's Day shopping at rebelnewsstore.com and use coupon code MOM2023 to buy 2 unisex shirts and get the third one free. We appreciate your support.